Good morning. Today we'll be talking about osteoporosis. Our topic is osteoporosis explained. Good morning, Dr. Odeniyi. It's a pleasure to have you and Dr. Adeyomoye on the program. Thank you for coming. And a lot of people don't even know what that is. A lot of people haven't even heard about it. A lot of people think that it's a condition that occurs in the developed world and not in the developing world. So can you tell us what is osteoporosis, Dr. Odeniyi? And is it common here? What are the statistics? Do we have any?
Thank you very much. Osteoporosis, when we talk about osteoporosis, we are talking about a disease of bone. And simply put, it means that the bones are weak and brittle. And as such, they have the tendency to fracture under minimal stress. Like somebody just tripping and the person falls. It shows the weakness of the bone. That is basically what osteoporosis means. It is not strange in our land. Unfortunately, we don't diagnose it more. It's commoner in the Asian and Caucasians. But with us, in the review that I've done, the frequency of osteoporosis ranges between 20 and 56%, depending on the location where we are looking at it in Nigeria. So that is the statistics.
That's very high.
That is quite high. That is quite high. We are talking about 1 in 5 to 1 in 2.
In what age? I mean, when does this happen? Is this so that we get an idea of what age we're talking about?
So we are talking about people from age above 45 onward. So we have quite a lot of women, especially it's commoner in women than in men. Of course, we have it also in men, but it's commoner in female than in men. And it occurs anytime above 45. But most of the time, you see it in people who are above 50 and in women who are postmenopausal.
Now, that's a very, very interesting one. There's some of those statistics you've given to us because, if it's as common as that, how come we don't know more about it? What are the kind of symptoms? Are there any kind of early symptoms and signs that people have? How would a person listening today who's over 50 and thinking to themselves, you know what, 1 in 4, there are maybe four ladies sitting together, and they're thinking, you know what, there are 4 ladies in this office over 50, could it be me? How do they know what the signs and symptoms are? How can they find out?
Unfortunately, at the early stage of osteoporosis, there are no signs, there are no symptoms. Where the bone is weak. What probably will point towards a problem is a simple fall that results in fracture. However, in some people, when it's advanced, they may just have back pain. And this back pain, most of the time, is as a result of a fracture of the vertebrae that have been there even before that day. And what the people also notice is that because of those fracture of the vertebrae, there seems to be an apparent reduction in height, and that's why we see some elderly women, they seem shorter than what they were some years before, and they also seem to bend forward, so they have a stoop posture. And these are the things we see in individuals who actually have advanced osteoporosis, but at the early stage there are no symptoms.
Oh, that's actually, as you say that, that's actually very interesting because I was actually something I was going to bring up. My mother is 88 and she actually has shrunk considerably, and she's definitely a lot smaller, and she has that stooped posture. So what are the risks? I mean, what are the kind of risks? You've obviously said it's more common in women, but are there any other risk factors that we should be aware of?
Yes. So there are some factors that we can change, and there are some that we cannot change. For example, we cannot change our gender, even though everything is there on the everywhere in the world now for changing gender. But the sex, we know that in women, it's very, very common in women. As we age, the tendency to have osteoporosis increases. It is commoner in white, but we have it in African also. For those who have a family history of osteoporosis, then descendants from that family also have a high risk of osteoporosis. And the body frame, has been shown that those who have lean frame have a high tendency to develop osteoporosis. So the muscle mass actually protects against osteoporosis. So these are the risk factors that we cannot change. We cannot change our race. We can't change our family. We cannot change our body size because it's genetic. And our sex we cannot change. Um, things we can change are our way of life, exercise.
What are the risks in the lifestyle, and how can we change them? How can we prevent osteoporosis while we're talking about it?
Thank you very much. Exercise, lack of exercise is one of the predisposing factors to developing osteoporosis because the bone gets weaker. So sedentary lifestyle makes osteoporosis risk to increase. Excessive alcohol consumption increases the risk of osteoporosis. Smoking also increases the risk of osteoporosis. So those are the life choices that are negative if we are not very active. Thing also comes in for those who have uh, other diseases that could predispose them to osteoporosis. Those ones are there. Some endocrine problem like thyrotoxicosis, they could also predispose the individual to osteoporosis. There are individuals who are on steroid for for treatment of some illnesses. They are also predisposed to developing osteoporosis. So there are a long list of things that could actually predispose to osteoporosis, but we can change. And those are the things we need to know. But basic thing is that we need to avoid the sedentary lifestyle, alcohol consumption, and quitting tobacco.
Well, I think that there's a strong message for me there, because I think certainly I need to increase the amount of exercise that I do to make sure that I don't develop it as badly as my mother has it now. But by God's grace, of course, I will live to 88 to be able to get there. Now we're talking about fractures. Amen. Now we're talking about fractures. So people fall and get a simple fracture. And that's the main thing. Are there anything else? Is there anything else that perhaps could be a complication apart from the broken bones that could be a problem with patients in osteoporosis?
Well, the broken bone is the major thing, and when they have fractures, it leads to other things. They become immobile. They can be bedridden, leading to pressure ulcers, getting infected, and that's shortening their quality of life. And at the end of the day, they don't probably live long to the fullness of time. So those are the things. Some of them, when they have this fracture, they may actually, because they are of the immobility that further confers on them, they have the tendency to develop clots in their limbs, and they can have embolism of that, which is very, very deadly. These are the risks, but the major thing is the fracture that comes and reduce the quality of life in this individual.
Okay, so thank you very much for that. Now, how do you make a diagnosis of osteoporosis?
To diagnose it, first we need to assess the individual. What we try to do is to look at the risk in an individual. And there are risk scores that we use to say that, oh, this one has a risk. And those who have risk, we further now look for, send them for tests to look for their bone mineral density. So we want to look at their bone, how dense it is. Don't forget that bone is packed with calcium. What is happening in osteoporosis is, the bone is in such a way that it is being, as bone is renewed, is broken down. And the rate of renewal is actually more than the rate of breakdown. However, in osteoporosis, the rate of breakdown is higher, and that is why the bone is weak. So we try to assess the bone mineral density, and that will tell us how the risk of having a fracture in that individual. And we do that by doing DEXA.
Yes, we're going to ask Dr.
And that's
Adeyomoye about that later. So, but are there any blood tests or any other things that you would do with this patient?
Oh yes. Well, because sometimes nutrition also contributes to it. So we want to look at their full blood count. Could they be anemic? We want to look at the kidney function, the liver function, because in some people who have some liver problems, they could also have osteoporosis, though not very common. I mentioned that those who have hyperthyroidism, so we need to do their thyroid function test so that we can properly situate what could be responsible for their osteoporosis. So those are the tests that we need to do. Then we tend to look at their vitamin D level in this individual because vitamin D also regulates calcium in the body. And if vitamin D level is low, calcium will be low. And this will predispose to weak bone that this individual has.
Wow, I think that's very useful to know. Thank you very much. Thank you, Dr. Adeyomoye, for coming on the program.
Thank you, Ma, for having me.
As a specialist in this area, can you tell us what's this DEXA scan? I'm very excited to know that we actually have a DEXA scan, and it's in LUTH, I believe, and actually available for this very specialized process. Can you just briefly, tell us what it's about and how important it is that people actually utilize it? A number of doctors are on this, often listen to this program, so they perhaps might not even know that it's available for them to use for their patients.
Okay. Thank you very much once again. DEXA means dual energy X-ray absorptiometry, and it's just a machine that scans the bone and tends to determine the density of the bone. As has been said by Dr. Odeniyi, the challenge with the elderly is that you don't want their bones to become so brittle and fracture. Because once it fractures, then it predisposes to a lot of complications, reduction in quality of life. So basically, this is a simple procedure. It doesn't last long. Patient walks in and changes to a gown and lies on the machine. The machine scans from the head all the way to the toe, and then brings out an image and assigns a Z-score. The Z-score is just a way to let us know if the patient is at risk or not. And the score can range from 0 to -2.
Now, this is having the DEXA scan is something that's, is it like the only one in the country, or do we have many of them? Are they being used? Do people actually even know they're here? Because one of the reasons people don't talk a lot about osteoporosis is the fact that people don't know about it because we couldn't really measure it or detect it properly before. So how has, your department now this, what difference do you expect it to make to the population?
Well, unfortunately, a lot of people do not know because the patient's turnover on that machine is low. And so many reasons can be adduced for that. Maybe because we don't have so much as because of the low patronage, most people don't want to invest in that kind of machine. So that's why I guess LUTH has one, and it's been there now for about 5 years.
Okay, so but the important thing is that
Yes,
we have
we
it
do.
now and people can utilize it.
Yes.
So what kind of message would you like to give to the GPs out there to encourage them to utilize this for their patients and for the geriatricians who are out there? What are the advantages of having the proper diagnosis?
Yes, well, it's very important that for those who see geriatric patients or the geriatricians, that they have, as I said, you want to prevent the risk of fracture. Most of the common areas where they fracture is the vertebrae. Unfortunately, that of the vertebrae may not be readily evident until they have lost height. That this patient has had some collapse of some of the vertebrae. The other one that we also want to prevent is fracture of the neck or femur, because when that happens at that age, that will mean that they have to go through surgery if they are to be able to ambulate again. So it's important that yearly screening is done for all geriatric
That's important.
patients.
Thank you so much. Dr. Odeniyi, now talking
Yes.
about the patients, we're talking about, obviously, you talked about the common areas, which are the fracture of the spine, the back, lower back, and the back pain you spoke about, and also of the hip, hip fracture, which happens, unfortunately, in a lot of these patients. How can we, but these, for example, like some of these happen after a fall. How can we prevent a fall in these patients?
Yeah, thank you very much. That is the most important thing to do. And so when we have elderly patients, the first thing to do is to make sure that we alter their environment. For example, we start from their bathroom. We must put railings so that they have something to hold. Tiling the floor is not really encouraged unless you are going to put a tile that is rough so that they don't slip and fall. Taking their bath in a bathtub is not encouraged at all. So we don't encourage them taking their bath in the bathtub, and we advise that as they grow old, if there is no railing in the bathroom or their toilet, they should have a railing that they can hold when they want to move around. And so we need to prevent that fall, and that is where most of the time they have the fall. When they try to use the bathroom, they slip and they fall, and they fracture all these bones we have discussed.
Now, we have a number of people who take a lot of supplements. They believe that, supplements can prevent all of this, taking calcium supplements, vitamin D supplements. How important are these? And what kind of treatments are there for people with osteoporosis?
Yes, diet plays a very important role. And as you mentioned, calcium is very, very important. And the source of calcium include the low-fat dairy products, vegetables, salmon, and the calcium-fortified meals. Of course, calcium and vitamin D is given together for us to get a very good result. There are drugs we give for those who already have established osteoporosis. There are a lot of drugs there that we can uh, uh, prescribe for them that will prevent fracture in this individual. It will not reverse fracture in those who already have fracture, but for those who have osteoporosis that has been confirmed by DEXA, you can put them on this medication. But it's not all about medication. We need to put some other things in place, like the non-drug treatment of this patient. We need to, in some of them, they complain, I can't sleep. So people tend to give them sedative. It is discouraged because they can have sedative and they feel drowsy and they can fall and still have a fracture. Now, exercise is very good, especially the weight bearing exercise. So what do I mean by weight bearing? Weight bearing means bearing weight on the bones and the joint, and this include brisk walking. For those who can still do the brisk walking, they do that. For those who can climb stairs, climbing of stairs is good. At the beginning, if it has not advanced, skipping is encouraged, and this actually strengthening the muscles of the lower limb. For the upper limb, uh, lifting some weight. How do we call this? There is this, not really the bar. Um, there's a name for it. You can actually carry it, and it tends to strengthen the muscles of the upper limb. So we need to combine this exercise with medication in those who have osteoporosis so that we prevent them from having fracture.
Yes, thank you very much. I think that's very enlightening. Now, in our culture, people don't tend to see some of these issues as medical. They tend to see these things as spiritual, someone's breaking their bones. What are the kinds of myths that exist, and how can we break some of the stigma and the people bring people who have these issues in?
We actually need to educate people more on this so that they know that the risk of the bone getting weaker is there as we all grow old. Though it is more in women, it's also there in the man. And just like Dr. Adeyomoye said, the individual need to do yearly screening, do their bone mineral density yearly by the time they are crossing 50 years. And so they need to do it yearly, and that will help us to assess their risk. We need to continue talking about this so that it comes to the awareness. Because when we see people who are elderly and they become shortening, right, and they are bent forward, most people look at them as, oh, this must be a witch, and maybe bad ways are caught up with that, which is not true. And that is why we need to go out there and make sure that people are well educated that that woman that you are seeing that is bent forward, that is short, is not probably a witch. It's just because she has had fracture of the vertebrae, and that is why she's now short and bent forward.
And I think one of the key things that you've spoken about is the fact that there's treatment to prevent it from worsening. Now, unfortunately, the program is already over, and there's no more time left. So do you have any last words to give to our listeners? Dr. Adeyomoye, perhaps you first, and then Dr. Odeniyi afterwards. Dr. Adeyomoye.
Well, as I said, yes, the last word is that screening is important, just like we encourage people to screen for other diseases. So during the routine health checks, people should take it as part of their health checks when you go to screen for your PSA, for prostate, mammogram, for breast cancer, also knocking the DEXA scan for bone densitometry.
Thank you. Dr. Odeniyi.
And when they have done the screening and we are able to determine the risk, they should come to the hospital. There are medications we can prescribe for them, apart from all the lifestyle changes that can actually reduce the risk of fracture, and that will improve their quality of life.
Thank you for watching. Please like, share, and subscribe for new video updates.